So this is a patient who is getting max sulfate, 20-year-old primate with pregnancy-induced hypertension, and you want to change your answer? Okay. We got urine output, respiratory rate, deep tendon reflex, blood pressure. What does magnesium do? Urine output, respiratory rate, deep tendon reflex, blood pressure, vaginal and perineal secretions, and bowel function. Just think about when is magnesium contraindicated. What's normal mag? 4 to 8, right? Okay. So we give the magnesium. We want to prevent preeclamptic seizures. So if you get hypermagnesemia, all right, you're going to see respiratory depression. You're going to see hyporeflexia. You're going to see cardiac arrhythmias and possible cardiac arrest, right? So what do you want to check for? Blood pressure, respiratory rate. I said hyporeflexia, so you want to check for what? Deep tendon reflexes. And you want to check urinary output. Why? Because if I'm not able to excrete it. Exactly. See how you got to break that down? With those select all that applies, you want to just read each one and kind of break it down, make sense of it, related to the question. So here's another one. When gathering a health history on a child with signs of abuse, which of the following observations would the parents would the nurse note as suspicious? Okay, so which of the following observations would the parents note as suspicious? Exaggerated emotional response, absent emotional response, poor physical appearance, conflicting stories, use of coarse language. This is a nursing observation.
What was the last one?
Use of coarse language. Okay.
Poor physical appearance. The second was absent emotions.
Absent of emotional response. And exaggerated emotional response. Now, the reason I say appearance wouldn't be it and use of inappropriate language, those are not indicators of abuse.
Okay.
Indicators would be an exaggerated emotional response, absent emotional response, and conflicting stories. During the first prenatal visit, a patient reports that the first day of her last menstrual period was October 16th. Based on Nigel's rule, oh Lord, determine the expected day of delivery. July 16th of next year, August 16th of next year, July 10th of next year, or July 23rd of next year. So what's Nigel's rule? Huh? What do you do? What's Nigel's rule?
I know what it is, but I can't remember exactly how many weeks we count.
Subtract 3 months, add a year, and 7 days. Mhm. So subtract 3 months from October.
That's July.
Okay, so then you're gonna add a year and add 7 days. And we said October 16th was her last menstrual period.
Okay.
So what day you got?
July the 23rd.
July 23rd of next year. Yep. Select all that apply. A patient is prescribed Tegretol or carbamazepine, needs education about side effects associated with this medication. The nurse should mention which of the following: excessive salivation, polyuria, a barking cough, risk of bone marrow suppression, risk of thyroid damage, risk of liver damage.
Okay, what was the question again?
That the patient's taking Tegretol and needs education about side effects associated with this medication. So what should you mention? And you've got excessive salivation, polyuria, barking cough, risk of bone marrow suppression, risk of thyroid damage, and risk of liver damage. What should you mention? So carbamazepine are one of those drugs with the black box warning because it has the risk of Stevens-Johnson syndrome. So what does that include?
That would be the bone marrow suppression.
Bone marrow suppression, liver damage, and thyroid damage, right? We know it won't be excessive salivation because Tegretol has an anticholinergic effect, right?
Right.
Right. Nurse admits to the ED a client and performs an ABG. These are your results. pH of 7.51, CO2 of 49, 85 O2, and a bicarb of 35. Which of the following describes this ABG result? Is it partially compensated metabolic alkalosis? Is it uncompensated metabolic alkalosis? Is it compensated respiratory acidosis? Or is it uncompensated metabolic acidosis?
Can you say that again?
The results are the answer choices. Okay. So you have a pH of 7.51, a CO2 of 49, a O2 of 85, a bicarb of 35. And we want to know, is this partially compensated metabolic alkalosis, uncompensated metabolic alkalosis? Is this compensated respiratory acidosis or uncompensated metabolic acidosis?
Uncompensated metabolic alkalosis.
Partially compensated metabolic alkalosis. Because there's an increase in pH and an increase in bicarb indicating that it's metabolic origin.
Okay.
The CO2 is also elevated, which tells that the lungs are attempting to compensate and retain. The CO2 goes down, but it's not fully compensated yet.
Okay.
So that's what you gotta look at. What are the two most important organs when it comes to acid-base balance?
The
Two most important organs when it comes to acid-base balance.
is that your lungs and
Kidneys.
your kidneys.
Now, this is a teenager. We have a teenager patient. Is being seen by the nurse during a sports physical. The patient complains how her acne is perceived by others. What stage is the patient in development? Industry versus inferiority? Trust versus mistrust? Initiative versus guilt? Or identity versus role confusion?
That would be the identity versus role.
Identity versus role confusion, right? They care about how others perceive them, right? In that stage. The nurses came for a patient prescribed ticlopidine. I never gave that. An antiplatelet drug. Which of the following lab results would the nurse alert that the patient may be experiencing an adverse reaction to this medication? Hemoglobin 15, glucose 235, potassium 3.1, neutrophils 500. And they're getting an adverse reaction to this medication.
You said it's what type of drug?
It's an antiplatelet.
You said the potassium was what?
3.1. You want the results again? Hemoglobin 15, glucose 235, potassium 3.1, and neutrophils 500.
Is it the hemoglobin 15?
Hemoglobin's within normal limits, right? Yeah. What the neutrophil count though? Neutrophil 500. What about that?
That's really low.
Yeah, it's kind of low. Like pancytopenia low, right? Yeah. So that's a reduction of the white blood cells. Normal neutrophil count is what?
10 to
2,500 to 8,000. Which of the following medications should the nurse expect the physician to order for a client at risk for peptic ulcers? Would it be loperamide, ondansetron, carafate, or Protonix?
which drug they will receive?
Yep. Peptic ulcers after severe traumatic injury. Remember we talked about this? Remember I told you? Which drug was that?
The ondansetron.
No. Ondansetron is Zofran. That's an antiemetic, right? What about protonics? Proton pump inhibitor, right? Protonic peptide ulcer. See the relation?
Yes.